18, 2024. It is 3:15 p.m. Central Time. Welcome to the first web briefing of the Iowa Advisory Committee to the U.S. Commission on Civil Rights. My name is Juan Garcia, and I serve as chair of the committee. I will now conduct a roll call of members present. For the committee members, if you're joining by phone, please press star six to unmute yourself, and then star six again to place yourself back on mute. Um, Vice Chair Henry Hamilton?
Hello?
Yep, he was going to. Okay, perfect. You're here.
Here.
Kyle Bergeson,
Here.
Paul Fessler, Katie Fiala, Adam Freed, Cynthia Kohler, Stephanie Munsterman, Allan Ostergren,
Here.
and Donald Roth. Okay, we have a quorum and we'll proceed with the meeting. Also present are Anna Victoria Forders, who is our designated federal official, Corinne Sanders, our support specialist, and Kyla McIntyre, an intern at the Commission. The U.S. Commission on Civil Rights is an independent, bipartisan agency of the federal government charged with studying discrimination or denial of equal protection of the laws because of race, color, religion, sex, age, disability, or national origin, or in the administration of justice. In each of the 50 states and the District of Columbia, and more recently established the American territories, an advisory committee to the Commission has been established, and they're made up of bipartisan persons who serve without compensation to advise the Commission on relevant information concerning their respective state. Today is the first in a series of web hearings examining access to mental and behavioral health for K 12 students. These meetings will help the committee understand the current issues in accessing mental health care for K 12 students and the civil rights implications, if any. Based on information collected through testimony, the committee will draft a report that will include findings and recommendations that will be shared with the U.S. Commission on Civil Rights. The commission will then forward those recommendations to the appropriate federal and state entities. Um, I'd like to share that at the outset, this meeting is being recorded for the public record, and the web hearing recording will be available on our public database. Please contact Anna at afortes, AFORTES, at usccr.gov. If you will like to obtain those records, or if you would like to receive notifications of future meetings. In a moment, I will invite our speakers to present for 15 minutes. After advisory committee members will have an opportunity to ask questions. This Q&A is reserved for committee members only. After the committee Q&A, there will be a public comment period where members of the public will be given an opportunity to share their perspective and opinions on the topic. If you're not able to share your full remarks today, please email your remarks to Anna at afortes@usccr.gov. Again, that is AFORTES at usccr.gov for inclusion in the committee proceedings. After public comment, the committee will then move into conducting committee business related to planning future briefings. If you're a panelist or member of the public, you might leave or choose to stay on the call as you wish, as all of the advisory committee meetings are open to the public. Before we move into the presentation, I want to remind everyone again that this meeting is being recorded and will be transcribed for the public record. I ask that you please state your name when speaking to assist with the transcription. Closed caption is also being provided for today's meeting. To view closed captions, click the CC icon on the lower left corner of your screen. Though some of the statements made today might vary from personal perspectives, we want to ensure that all invited guests feel welcome and do not defame or degrade any person or any organization. As the chair of today's meeting, I reserve the privilege to cut short any statements that defame, degrade, or do not pertain to the issue at hand. Any persons or organizations that feel defamed or degraded by statements made by these proceedings may respond and submit written statements for inclusion in the proceedings. I urge all persons to making presentations. Oh, 1 second. To be judicious of their statements and remain on topic. The Iowa Advisory Committee appreciates the willingness of all participants to share their views and experiences with the committee. Today, we will hear from speakers involving school counseling services and administration throughout Iowa. Presenters, please aim to stay within your allotted speaking time and reserve additional talking points for the Q&A portion, in case you're not able to address them within that time. Anna will be sending you messages through the chat box to let you know when you're near the end of your speaking time. Okay, with that said, let's begin today's meeting. We will hear from representatives from the Iowa School Counselors Association, Courtney Cook and Erin Lane. Allan Eckelman, a school counselor at Beckman Catholic High School. Jacob Rees from the Scanlan Center for School Mental Health. At this time, I'd like to invite Courtney Cook and Erin Lane to begin.
Thank you. We want to thank the members of the committee and the public for joining us in discussing this very important topic. We appreciate the attention given to the youth mental health concerns we see in Iowa and value being a part of the conversation. My name is Courtney Cook. I'm currently the president of the Iowa School Counselor Association and have served on the board for the past 3 years. I'm a licensed Iowa school counselor and administrator, and am currently serving in the role of PK-12 principal and supervisor of school counseling in Iowa. I have a master's in school counseling and a master's in educational leadership and policy studies.
And my name is Dr. Erin Lane. I am currently the Iowa School Counselor Association Vice President, representing counselor educators and school counseling preparation programs around the state. I have held this role for the past 5 years. I'm a former Iowa school counselor and current counselor educator in Iowa. I have a PhD in counselor education and supervision, conduct research on school counselor practice and identity, and serve on the Policy and Position Committee for the American School Counselor Association.
The Iowa School Counselor Association is a state organization that supports and advocates for school counselors. We are affiliated with the American School Counselor Association. ISCA supports around 700 members throughout the year by advocating for the profession at the local and state level, providing ongoing professional development through the means of webinars and an annual conference, and hosting an email listserv available to both members and non-members. Before we discuss why school counselors may be concerned about youth mental health, it is important to make sure everyone has a shared understanding of what a school counselor is trained to do. First, I invite you to think back to your interactions with one of your school counselors. For some of you, you may have thought of interactions that consisted only of high school schedule changes and career conversations, if that. Those counselors you remembered were likely working as guidance counselors. They were trained or held to others' expectations to support a small number of students, mainly those who were college bound. The change from the title of guidance to school counselor in the early 2000s has come with a significant shift in their preparation, role, and intended function within the school. The school counselors of today are prepared to support all K-12 students holistically with academic, post-secondary, social, and emotional development and issues. They learn to be collaborators, leaders, student advocates, and systemic change agents. School counselors are now data-driven, evidence-based counselors who work on prevention and intervention within the school setting. In almost all of Iowa's preparation programs, school counselors are prepared alongside clinical mental health and rehabilitation counselors. Most programs require their school counseling students to have 60 graduate credit hours in education, counseling, and child development courses, in addition to at least 700 clinical hours in schools prior to obtaining their initial school counseling license.
When a school counselor is working as they were prepared, their role can be compared to that of a primary care provider with professional and ethical standards. So take a moment and think about what you would go to or take your child to a primary care provider for your physical health. Ideally, you would see that provider regularly for preventative care. As a school counselor, preventative care looks like teaching social, emotional, academic, and post-secondary knowledge and skills. You may also go to a primary care provider when you're having some concerning symptoms, or they may call you in if they see something that needs follow-up from your preventative visit. The primary care provider would give you strategies and interventions and talk to you about possible options for making changes to alleviate your symptoms. As a school counselor, when students come to see us or data shows that they need additional support, we teach targeted skills and counsel them through evidence-based interventions. Finally, if interventions from your primary care provider are not successful, it's their ethical and professional responsibility to refer to a more specialized provider. As professional school counselors, this means that we reach out to mental health counselors, social workers, and/or psychologists, depending on the primary cause of the academic, social, or emotional challenge. As the primary mental health provider in schools, school counselors are on the front line of the youth mental health crisis in this state. We are with students for at least 7 hours every day and are often the only ones in the schools with comprehensive mental health training. Like the primary care provider, school counselors are often called upon to support students in the first moments of a mental health challenge. This can be even before the student realizes that they're struggling with their mental health. Parents or guardians, teachers, peers, or even the students themselves can all reach out to school counselors for this early intervention. In a recent survey of 145 school counselors in Iowa, 95.2% report social and emotional health services on most days of their practice. This makes sense given all the data we know about youth mental health. According to the most recent data from the Iowa Youth Survey, 27% of sixth graders, 29% of eighth graders, and 36% of 11th graders reported feeling so sad or hopeless almost every day for 2 weeks or more in a row that they stopped their usual activities. Data also indicate that almost 11% of youth in Iowa, ages 3 to 17, have anxiety concerns. Even more striking is the data around youth suicide in Iowa, sharing that 24%, almost a quarter of 11th graders in Iowa have considered dying by suicide in the past 12 months. Data from 8th graders and 6th graders is also alarming. While this data helps us understand the scope of the problem, school counselors don't need to see that data to know that there are significant numbers of youth struggling with their mental health in Iowa. They see those students in their offices weekly and sometimes daily. They're working with educators, school administrators, parents, guardians, community liaisons, and classmates to provide comprehensive interventions and preventative services, but they can only do so much. We see 4 main barriers to youth obtaining mental health services in this state.
First, school counselors are often not allowed to work to the highest level of their counseling license. School counselors are uniquely trained to meet the social and emotional needs of all students in schools, but in reality, they are also often tasked with supervising study halls, monitoring recess or the lunchroom, creating student schedules, overseeing the administration of standardized tests, and manually checking graduation requirements. Therefore, one of the most significant barriers we see to providing youth mental health prevention and intervention services in schools is that master's level school counselors are regularly asked to take on substitute teaching and administrative assistant duties rather than the role they are uniquely prepared to do. Iowa schools are not using their school counselors to the highest level of their license. As one school counselor is quoted in a 2024 survey, "At this point, I do not feel like a valued master's level counselor. I feel like a glorified administrative assistant." The second barrier is the lack of school counselors and mental health providers specializing in child and adolescent development. Even if school counselors could work exactly as prepared, we must acknowledge that we still have a shortage of all types of counselors and mental health care providers in the state. As one survey respondent stated, there are not enough private providers for needs that are ever increasing. The words you see on the screen right now represent the qualitative data gathered in that research survey when counselors were asked about the barriers to mental health in the state. You can clearly see the words lack, mental health, providers, and services are most frequently mentioned as barriers. For context, school counselors in Iowa have caseloads on average of 1 counselor to every 353 students. This is 100 students over the American School Counselor Association recommended ratio of 1 to 250. And if the school counselor needs to refer students to a specialized mental health provider, they often cannot find anyone to refer them to. The Iowa Department of Public Health has designated 92 of its 99 counties as mental health care shortage areas, and the number of providers is further limited when looking for individuals who specialize in youth services. 3/4 of school counselors believe mental health care is difficult to access in the state.
The third barrier to youth mental health in Iowa is logistical access to mental health providers. School counselors report that even when specialized mental health counseling services are available, additional barriers exist, such as significant wait lists and lack of or inadequate insurance coverage. Additionally, school counselors report having to address adult stigma against mental health concerns when talking to parents about their child needing additional services. And when parents are open to it, they often have difficulty getting off work to take students to appointments. To alleviate the transportation barrier, some schools have contracted services with mental health providers in the area so students can see mental health counselors within their school setting, either in person or via telehealth. However, school counselors report that there's a high turnover amongst these counselors and have found that continuity of care is not assured. Lastly, the fourth barrier is that school counselors now report a lack of state and local support for counseling services in their schools. Over 3/4 of respondents in one research survey indicate that they feel the mental health services they provide are not as valued by the state as they were just a few years earlier. The data conducted by ISCA also indicated that over 3/4 of Iowa school counselors perceive their job as more difficult than it was prior to the passing of educational reforms in the 2023 Iowa legislative session. The vague wording of the education reform bill and lack of state and district level guidance on interpretation and possible repercussions were noted as the most significant of these barriers to their job. From one school counselor, quote, "I am so afraid I'm going to do something wrong without meaning to and get in trouble, either by the state or parents or my administration," end quote. School counselors entered this profession to help kids. However, as one respondent put it, quote, "We had a Google Zoom with our district's attorney to discuss how the survey law affects our practice. Essentially, we were told not to even ask how a student is feeling," end quote. From our conversations with Iowa legislators, we know that they care about the mental health of youth in Iowa. Still, in the perception of most Iowa school counselors, their legislative actions do not seem to accurately reflect that care and concern.
While these barriers impact the mental health services for all students in Iowa, the four barriers presented affect some students more than others. The population specifically noted by Iowa school counselors as being significantly impacted included LGBTQ+ students, students of color, English language learners, students from low-income families, and youth with significant mental health diagnoses. These populations often overlap. However, each group individually has been noted through data as being at heightened risk for mental health challenges. They also have unique social and cultural situations that must be considered to provide effective mental health interventions. We are happy to provide those data and interventions as requested. Regional differences in Iowa also add to the disparities we see in mental health services. While urban areas still lack youth service providers, rural areas face significantly more shortages in mental health providers. To address the natural disparity of the number of providers available in rural areas, there has been a rise in telehealth care made available. Unfortunately, unreliable internet connectivity hampers effective telehealth solutions, and telehealth solutions are only available to older children. Counselors also need more training in evidence-based practices for telehealth, compounding difficulties in delivering quality care. Furthermore, there is a noted stigma in rural communities associated with mental health that prevents many from seeking help. The stigma and a general disconnect in values between rural populations and urban-based counselors exacerbates the gap. Even when in-person services are available, transportation barriers often make these services inaccessible.
Fortunately, school counselors have programs and organizations around us that we can reach out to for support. Some of these organizations directly support students, and others are meant to support school counselors in our work. Specifically, we know that school counselors have utilized the Scanlan Center for School Mental Health for up-to-date evidence-based mental health interventions that school counselors can use. ISCA has also partnered with them to provide full-day in-service continuing education to our members. We also highlight the Iowa area education agencies, which provide significant post-graduation professional development to school counselors. Each AEA has at least one staff member who supports school counselors and can provide resources and interventions appropriate to the populations being served by their districts. AEAs also provide immediate crisis response team services, which are essential after tragic events that impact school communities. Direct services come from more regional or local community resources and assets. Organizations such as the mobile crisis units assist school counselors when students are actively experiencing a mental health crisis and need additional assessment and transportation to facilities where they can access immediate care. Currently, these services are overseen by the Mental Health and Disability Services regions in the state. Because these are managed regionally, the services depend on the organization and providers in the area. So what can the state and federal government do to alleviate youth mental health challenges? The federal government can continue ESSER funding and earmark it specifically for mental health resources, which can be used to hire additional school counselors and school-based mental health counselors. Both state and federal governments can also provide funding to prepare future school counselors and mental health providers, which will be essential to improving access to youth mental health services. The focus should be on recruiting and retaining counselors with diverse identities and experiences, and those who want to work in rural settings. Both governmental entities can also focus on improving quality of life, which has been shown to positively impact mental health outcomes. Regarding the state recommendations, one step would be to require social, emotional, and mental health preventative skills to be taught K-12 in schools. Additionally, school counseling preparation programs should be required to include trauma, crisis, and mental health interventions specific to youth as part of their core curriculum. Lastly, the state should consider repealing or amending Senate File 496, as counselors report sections of that bill have created unnecessary challenges for students to receive critical preventative care and initial short-term interventions in schools. We thank you for your time and attention to addressing youth mental health challenges in Iowa, and we welcome your questions so that we might work together to better support our students.
Thank you. Thank you very much, Courtney and Erin. Thank you for everything you do. Now we're going to, and please save your questions for the Q&A portion of the meeting. Next, we're going to hear from Allan Eckelman, a school counselor at Beckman Catholic High School.
Good afternoon. My name is Allan Eckelman, and I'm the school counselor at Beckman Catholic High School. In truth, Beckman Catholic High School is a 7-12 school. We serve grades 7 through 12. We have 333 students. About 100 of those are in the grades 7 and 8, and 233 of those are in the high school. We have a graduation rate of nearly 100%, with about 85% of our students, graduates, going on to some form of 2 or 4 year college. The other 15%, a high proportion of which are boys, generally go into the workforce, some in farming and dairying, which are consistent with the area around us. The remainder working in local manufacturing plants here in Dyersville or in Dubuque. Especially post-COVID, students have experienced higher rates of absences due to stress, anxiety, headaches, and a general inability to graduate or function in school. Our parents and the community members are much more likely to accept physical causes for illness than say that we're dealing with mental health reasons or psychological issues. There remains a stigma about seeing, needing, or referring someone to a mental health therapist, clinic, or for assistance in identifying the needs of the kids. I would say that we have experienced a lot, have experienced and work a lot with students expressing high anxiety. Depression is something that we deal more with and understand and work with better. Those two are the ones that are probably the ones that we deal mostly with in school. There are few mental health related resources in Dyersville. Most of the mental health related providers are in Dubuque, which is 25 miles away. As stated in the earlier reports, some of these are covered by insurance costs. Often the insurance costs are limited, or they limit the number of hours or times that they would work with those. Beckman's been able to sign a contract with an agency in Dubuque to provide a mental health related therapist who provides services on site at Beckman 2 days a week. On the other days of the week, she serves 4 other elementary schools. We've been able to provide individual appointments, some weekly, some bi-weekly, to up to 5 students at a time. In addition, we've been able to provide three group counseling sessions to work with students on mental health issues and other related issues. These groups are usually 5 to 10 members, usually meeting for 8 sessions, and usually referred to as friend groups with subjects such as stress in school, relating to adults, and the like. Through this arrangement, we've been able to engage more students and, when necessary, make referrals to mental health clinics and specialists in Dubuque. That brief is the statement that I have. I look forward to answering any questions and to participating in the rest of this today's meeting.
Thank you.
Thank you.
Thank you very much, Allan. Thank you for your comments. And again, thank you for everything you do for our students. Next, we're going to hear from Jacob Priest from the Scanlan Center for School Mental Health. Jacob?
Sorry, I was muted. Good afternoon, everyone. I'm Jacob. I apologize for being a little bit late. I'm in clinic today. I am kind of coming here, I think, especially in my affiliate role for the Scanlan Center of School Mental Health. And within that role, I've really had the opportunity, I would call it the privilege, of being in schools all throughout Iowa to deliver mental health training to teachers, paraeducators, all across the state, right? As I missed the other one's name, but Erin Lane, Dr. Erin Lane, who is my colleague, we're talking about the AEAs. I've also been working with them over the past few years as well, talking about this type of thing. But my remarks today, I want to keep pretty brief, but I want to share 2 stories that I think are fundamental to what I see and experience as I go to schools and talk to teachers and educators all across Iowa. The first, it happened, I think it was 2 weeks ago in Tama, Iowa. So I was there, I was training teachers on mental health care, and it just so happened that after I was all done, the principal came up to me and we started having a conversation. Part of my role, and that's where I am today, as I work at UIHC and I direct the LGBTQ clinic, well, at least the counseling piece of that. And he came up and said to me, I feel like our hands are tied. And I said, about what? He's like, you know, I've been doing this a long time, 30 years. We've had trans and non-binary kids for years. And we always want the parents to be involved in all the decisions. And we feel like there's nothing we can do. We can't even talk about kids' identities or nicknames anymore, because all of a sudden, when we do that, we have to potentially out them to their parents. And for whatever reason, they may not be ready to do that. And we just don't know what to do. And in thinking about that, and in thinking about that conversation, I go back to a story I tell almost all of the time that I'm presenting to these teachers and paraeducators. I tell them to imagine themselves that they're right next to a river and they're overlooking it. I was in Clinton, Iowa last week, so I imagined it was the Mississippi River. I said, is there a river that runs through the city? And they're like, yeah, there is. And I said, okay, you're looking over the Mississippi and all of a sudden you see a kid floating in the river. What are you going to do? And the response was, well, we're going to get that kid out of the river. If we have to jump in there, if we have to call somebody, we're going to get that kid out of the river and make sure they're safe. And I said, yeah, so imagine you do that. You jump in the river, you pull the kid out of the water, and as soon as you get to shore, you look there, and there's another kid, and then another kid, and then another kid, and then another kid. And all of a sudden, what do? Well, we start building all of these structures to rescue kids out of the river. Like we'll probably get really creative and we'll put, towers up there with somebody on a swing who can just swing down and grab all the kids out of the river. But nothing actually changes until somebody stops and says, who keeps chucking those kids in the river? Right? And so when we're talking about shifting mental health for youth in Iowa, when providing teachers and educators with the resources to do that, I think we have to be cognizant about the downriver effects of the policies and structures that we create. Working with a lot of trans and non-binary kids, some who don't even want access to medical intervention, but seeing the amount of burden and pain them and their families received as during the last 2 legislative sessions, there have been bills that have been put forth that directly target them. And to me, those are the things those types of patterns are what keep kids getting chucked in the river. And unless and until we can start to think collectively of how we can build in the policy structures and supports to really help these kids, what we're going to do is the awesome work that these teachers, these school counselors do every day, right? I know these school counselors are overwhelmed and often have more people on their caseload than they know what to do with. And then they have to bring in outside sources. And they are doing their best to keep these kids, from drowning in the river. They're there to pull them out, to give them the hand that they need. And they do such a great job. And if we really want to support them and help them, we really have to be cognizant and proactive about thinking, how do these kids keep falling in the river? So happy to be here. Thanks for the invitation and look forward to any questions.
Thank you very much, Jacob. Thank you for your work and the passion you bring to it. We're going to move to the Q&A section. I'd like to, oh, sorry, 1 second. I got a message here. Start. My camera is acting up. Can everybody see me? Yep. Okay, perfect. So before we move into the Q&A, I'd like to remind members of the public that if you're interested in offering public comment following the Q&A session, please raise your hand by hovering your mouse near the name to let the staff know you would like to speak. We will add you to the list and we'll announce your name. So we're moving into the Q&A portion of the meeting. This is for committee members first. We will have a limited amount of time, so please be succinct on your responses, and same to the committee. Please indicate if you have a question for a specific speaker or if directed to all speakers. If members have additional questions, I'd like to ask you to use the raise hand button. And for members joining through the phone only, you can press *6 to raise your hand and unmute yourself again. Now we are going to start with Jacob Priest first, and we're changing the order because Jacob made the time to join us, but he has another commitment. So if any one of the committee members has any questions for Jacob, please start now. Anna, do you see any hands up? I don't from my end.
Well,
Oh, Henry, go ahead. Yes.
Yeah, Mr. Priest, yeah, we were talking about preventing kids from getting in the river in the first place, and I really like that analogy, and I may steal that from you, by the way. So, but getting more concrete, what steps can be taken to stop the kids from getting in the river, and then have there been steps taken that may have increased the number of kids falling in the river?
Yeah, so I'll try to keep that as succinct as possible. I think two things, right? In meeting with teachers, school counselors, educators, they build relationships with students in really cool ways, unique ways, and trusting them and those teachers to make those decisions, to know and be responsive to their students, I think is one thing, right? I also think about, when we think about falling in the river, we think about what I refer to as adverse childhood experiences and or lack of resources, right? If a kid is in a situation where they don't have access to food or safe shelter, the likelihood of them falling into the river is going to be much greater, right? If they're in a place where they don't have a safe adult, they're going to end up in the river. Everyone faces adversity. Everyone experiences anxiety and symptoms that don't make us feel good. The difference is what do we have around us? And, you know, if we're talking about a mental health diagnosis or crisis being in the river, all of those things before that make the difference, right? And in my opinion, right, the policies that serve to remove those structures and supports, or, you know, the guardrails around the upper part of the river, are ones that remove the relational, community-based, you know, access to food and shelter and good quality healthcare. Those are the things that are going to put kids at risk, right? Those are the things that put families at risk. And so often we think about it as a very, you know, even the analogy of a river is a very linear process, but I like to think about it as a system, right? And if we don't think about all of the steps in the system, which pulling kids out of the river is always going to be an important step, but building those barriers, providing that safety, getting kids more knowledge about how they fall in the river and how to avoid that, getting teachers and parents that knowledge too, is so key. Just one quick story. As you see, I like stories, and then I'll be quiet. After the murder of the teacher in Fairfield, Iowa, I was a part of the response team that went and spent some time down in the high school there. And one afternoon, we kind of just had an open door policy after we had spoken to all the students. And I think they had lunch, but it was the whole junior class almost, I felt like, or at least a good chunk of them that showed up, and we had a conversation. And all they wanted really was just to let someone know that they were scared, that they were hurting, and that they were grieving. And then once they did that, I said, then what do you all need? And they said, we need better relationships with our administration. We need them to trust us. We need to be able to feel like we have space to explore and make mistakes and not have to, you know, be perfect all the time. We need to know that we're trying our best and it's hard. And so for me, those types of conversations, in addition to all these structural supports, are really key to keeping kids out of the river and helping them get out of the river once they're in it.
Thank you.
Thank you, Jacob. Thank you, Henry. Any other questions from committee members for Jacob first, because I know he has to step out. Paul, I see your hands raised.
Yes, you mentioned the issues with the legislature and the bills that have gone through, which clearly represent at least a substantial part of Iowa having certain concerns. How do you get counselors to gain the trust of those types of parents who might feel counselors don't share their worldview?
Yeah, so I sit with parents all the time who come to me because their kid has come out to them. Typically in my work, it's not so much as a kid coming out gay, lesbian, or bisexual, but mostly trans or non-binary, right? And I was having this conversation up in Waterloo last week, right? And part of me wants to say like, well, don't you love your kid? If you loved your kid, you would support them. What we don't think about is how much those parents are really invested and love their kids, right? In some ways, before they knew their kids at all, they might have known the gender of the kid. And when they create that, you know, when we don't know, you know, before the baby's born, before it can talk and walk and all that, we create a narrative of what their life is going to look like. I have a 2-year-old daughter, and I think about, oh, maybe one day I'll walk her down the aisle, right? And if she comes to me later and says, hey, Dad, I'm actually this, part of me is going to grieve and be sad and scared and worried about what's going on there, right? So when I meet with parents, I meet them where they're at because it makes sense to me, right? They love their kid, they've known their kid, they've raised their kid, and all of a sudden, what they kind of had mapped out for their kid feels foreign and sometimes against what they believe and hold dear and most sacred. And, you know, I know, you know, a lot of the counselors that Erin trains, and they would respond to it in the same way as, I get that. I understand that. I'm here for you. And let's figure out a way where we can work together, where we can figure this out, where we can move together as a family, as a community. Because oftentimes it gets down to that all or nothing, support or not support. And that's not how life works. That's not how relationships work. But when we meet those parents where they're at, most of the parents I know, right, over time, we have good conversations. We talk about it. They may not come to the exact same place I am, but often we come to a place where their kid can be who they are and they can feel safe and connected in that.
Thank you, Jacob. Any other committee members before we move on? And just to make sure that we're staying within the scope of what the committee is and does, right? So how do we tie this to putting a civil rights lens to it, right? So one of my questions for Erin, Jacob, Allan, and oh my gosh, how can I forget her name? Is from an access standpoint, I think based on the data that you have shared at the beginning, right? So where are we from an access standpoint to those services, one? And then two is how early should we start? Right? I mean, how early I mean, are we talking elementary, having counselors you know, getting closer, deeper to provide that those services? And please go ahead.
Well, just in response to the second half of your question, especially, yes, having access as early as kindergarten, pre-kindergarten, helping kids name their feelings, helping kids just be able to to talk about emotions and things that are happening in their lives with a trusted adult, with their families, with their peers. Normalizing that type of conversation is a really important part of what school counselors and schools should be doing. It is a natural thing to want to talk about your emotion, but especially with kids, they don't even know how to name emotions. And when you can't name an emotion, oftentimes that's when you have the temper tantrums. So in schools right now, we are seeing kindergartners throwing chairs across the room. We're seeing elopement, like running around the school with first graders, second graders, where you're having to go into crisis management response in order to help that kid not hurt themselves or others. And a lot of that behavior, right? Behavior is communication. And a lot of that behavior is telling the adults in the space, I'm not okay. And so how do we help that kid settle and regulate themselves and then share what emotions they are feeling? And so I would say that, yes, it is essential that we have counselors within those spaces so that they can help students even before they get to that dysregulated space, to be able to just sit with them and talk. I mean, we have PBS and Sesame Street and Daniel Tiger for a reason, right? To be able to help kids talk about those feelings in a safe space of their home environment. And so that is essentially what school counselors in elementary schools are doing, is taking those same types of lessons and turning that into the school. So now you're learning how to work not only with your family, but also within another structure, with peers, with other adults in your life that care about you, and work through those conversations in that way. Yeah, I guess I'll stop there and let somebody.
Thank you, Erin. That the passion comes through and great. Thank you. I love it. Mr. Hamilton, you have a question.
Yes, along those same lines, the first panel talked about one of the access things might be starting to teach social and emotional skills as from K to 12. And I was just interested in what's going out there around the nation. Are other states doing that? And where does Iowa rate in there?
Absolutely. Well, I'd say, our school counseling profession is designed to deliver those age-based, developmentally appropriate social emotional skills lessons. Where I think we've seen a dramatic shift in the recent years that might correlate with, as we shared in the last few years, school counselors have felt feeling less valued, feeling less supported, as it's been an interesting shift. And it seems like new barriers are being put up left and right. We are being limited on how we screen like we used to, how we, pre-assess to where there might be risks for mental health challenges or needs for additional support. There's also constantly a threat of limiting what social emotional lessons we can provide and what the language is as we provide those social emotional lessons that are so critical for what Erin was just describing, that the significant behavior challenges we are experiencing, particularly in the elementary. The more we remove those proactive lessons, the worse that becomes. And then we're got babies in the river, like Dr. Priest was sharing. So it's been an interesting shift just in the recent years. And whether that's, fear-based, a lack of trust, or just uncertainty, I'm not sure. But instead of removing barriers, it seems like they just keep on coming up and up.
And as far as one follow-up, if I may,
Yeah.
As far as the provision within Iowa of those that kind of a skill training in Iowa K to 12, do you see any disparities between urban, rural, wealthy, lower income, or private school communities? Yes.
I would say, for my own personal experiences, I've served as a 612 school counselor. I've served as a regional social emotional behavioral health coordinator at an AEA, and now I'm in a PK-12 principal position in a rural school. I think our biggest barrier is funding to have enough supports available, and then professionals to fill those positions. And so, our ratios might look okay as far as like number wise of students. We have smaller number of students in schools, but one professional might be servicing multiple buildings. Like I believe the other school counselor on the panel was suggesting some of the school counselors have to drive between different buildings, or they're half-time school counselors. And so then you're just, dividing that work even further. So I would definitely say that's probably one of the biggest barriers in our rural communities is delivering that. And then there's some, just different cultural subsets of, the knowledge of parents and maybe the financial burdens that they're experiencing at home that might be exacerbating the issue. I'll let some of the other panelists speak to that.
Thank you, Courtney. And I think it's a very important recognition, right? To see what happens in urban Iowa versus what's happening in rural Iowa. And also, as a minority myself, I'm originally from Peru, understanding the whole student. What is happening at home before that student even comes to the building, right? What have they experienced, which is impacting their behavior and everything else. So thank you for the comments. Allan, anything from you? And Allan Eckelman.
I would just say that, like you were saying there, we're all, regardless of the type of school we're in, we're all feeling the financial pinches. Last year, there were two of us working in this building, and now there's just me. And so, you have to take on meeting the needs of all of the kids rather than having some of them focused primarily on the middle school and ninth grade and me on the upper grades. Um, and it just spreads us thinner and thinner. So financial concerns, and I know that's true in the public schools too, as it is in Beckman being a private school, that uh, uh, finances are always an issue. I do think one of the things that's a positive that we experience here is we have a high level of parent engagement, and parents uh, engage with the school. They attend conferences well. They want to know. They appreciate phone calls and things like that. So I think that one benefit we have is that uh, our parents are able to. I know a lot of places, because of work schedules and stuff, parents can't engage as much with the school and stuff, but our parents here find a way to do that. Um, the critical thing, I think, though, is just that in the rural areas, like in Dyersville, is not as nearly as rural as other areas of Iowa, but there are just few providers here. So you really have to you have to work hard to find someone. Most insurance that families have, it doesn't cover a, a, a complete treatment program. So you have to kind of pick and choose and see what you can and where you can provide things with. Those are the things that we kind of face and see. The lack of mental health services in the local community is a problem, and I think in virtually every rural town.
Thank you, Allan. Do we have any other questions from committee members? Okay, hearing none. Anna, I'm gonna move over to public comment. Do we have any members of the public? Anna?
I'm just giving a healthy pause for members of the public to raise their hand if they're interested in offering comment.
Okay, I just wanted to know whether we had people in or not. Thank you. And thank you to our panelists, Erin, Courtney, Jacob, Allan. Hey, I can see everybody's names now. For your comments, taking the time to join us, and more importantly, for what you do as the father of 4 daughters. My goodness, thank you. They're grown and out of the house and out of college, but um, I remember those days, and oh my goodness, things are only getting harder and harder. And so thank you for everything you do. Okay, we don't have any members of the public that would like to offer any comments. So I am going to move on to the closing remarks. Um, please know that we have more web hearings scheduled and we welcome you to join us. We plan, and my screen just went away. 1 second, please. We plan to have our next one on Thursday, May 23rd, 2024 at 3 p.m. from 3 p.m. to 5 p.m. Central Time. In the chat, the staff will include information on how to register for this upcoming web hearing. Thank you for joining us. We appreciate your time and look forward to having you join our next few web hearings. The Iowa Advisory Committee, please stay for a few minutes for our brief business meeting. Everyone else, please enjoy the rest of your day. And thank you very much for joining us. It's great to see you.
Thank you for inviting us.
Yep, thank you very much.
Okay, Juan.
Thank you. I think we are just committee members now. And
Yes.
okay, did we stop the recording?
No, this is still a business meeting. It's still a public
Okay.
meeting. Folks
Perfect.
are still able to join if or are welcome to stay if they would like to.
Okay, perfect. Thanks everybody. I think you went very well. I appreciate their time and their passion for what they do. I mean, it becomes a hot topic, especially with legislative changes and things that are coming that will take effect, later this year. You're muted, Anna.
I have two screens that I'm like looking at, so it's a little difficult to toggle back and forth. Yeah, congratulations on hosting your first web briefing on this project. We have a couple of announcements related to your next two web briefings. The first, and I'm just gonna pull up my, let's see here. Pull up monday.com for you all. Or maybe it's easier for us to view the committee's webpage online. And Caitlin, if you can help support, if you could just fill it or let the committee know who's scheduled for the May 23rd web briefing. I need some time to figure this out.
Yes, give me one moment here. So I believe the May 23rd web briefing is, let me pull up my document here.
We had a speaker who was scheduled for today's web briefing who preferred to participate on May 23rd. Her name is Tammy Valens. And so we had to adjust the schedule.
Yeah, Tammy will actually be presenting on the 30th and May 30th. She is a school counselor at Perry that I believe Juan had.
Yes. Yeah, she's a dear friend. I've known her for years, and as a reminder, Perry was impacted by a school shooting in January. So, I mean, she will have firsthand knowledge, and it's still, I mean, they're still dealing with that. So how they're helping the students and all of that. So I thought that she would bring a different perspective to the conversation. So I'm excited to hear her comments, ideas, suggestions, all of that.
And then the two other confirmed panelists that we have for the May 23rd briefing are Renee Hardman, who is the Executive Director of Lutheran Services in Iowa. The committee had expressed interest in wanting some of the religious-based service providers' perspective. So she will be presenting. And then we also have Karen Mackey, who is the Director of the Sioux City Human Rights Department. And she was a direct recommendation from the committee as well.
Yeah, Lutheran Services will have again a different point of view as well. With they do a lot of work with migrants, immigrants. I mean, all over this the area. So another angle as to what they see.
Yeah, so with the May 23rd web briefing, we have 2 speakers lined up. As Kyla was doing outreach,
Did you say May 23rd or May 30th?
For May 23rd, we only have 2 speakers. Kyla had corrected me on the availability of Tammy Vallin. She's actually available on the 30th. Okay. So the 30th, we have 3 speakers lined up. The 23rd, we only have 2 speakers lined up.
Okay, so we're having two meetings week to week. Okay, just to make sure.
Yes, back to back. Correct.
Just to make sure that we have the calendar invites for all the participants, all the committee members. That way, it goes on the calendar, and whether they're attending or not, they will have it, and there's no excuse but to join.
Yeah, we'll send it out. We had a little bit of technical issues today, and hopefully it'll be ironed out by the next meeting.
No worries.
As I was saying, while Kyla was doing outreach to speakers, a couple of them had actually recommended, or I believe 2 had recommended some names for the committee to consider. But before I go into that, we have some updates regarding 2 of the other folks who had reached out to, one with the Department of Health and the other with the Department of Education. Those 2 individuals, Kelly Garcia, who's with the Department of Health, and Mackenzie Snow, those 2 were, their offices were unavailable due to being involved with the legislative session and having to provide either testimony or prepare reports for the legislature. So they were really caught up with a lot of that work, and so they're unavailable to participate. And we're hoping perhaps they would instead offer written comment. I know that we had reached out to, was it Allan, Kyla, who had a
Yeah, I was just going to say, I can reach out to HHS again.
Okay.
Session should be winding up here any day now. And I had another matter that prevented me from making that contact, but I can do that now. It's resolved. So.
Okay. Yeah, we figured the legislative session was taking up a lot of potential speakers' time. So, as they're winding down, hopefully their schedule opens up. I mean, do you know when the legislative session wraps up?
I don't think they know, but I saw today the House voted to suspend the rules on notice on the debate calendar, which is a sure sign that they're getting to the end because it'll come fast and furious. So I think Sendai will happen probably maybe tomorrow, maybe Monday or Tuesday.
Okay. So potentially then they would, if they were to accept an invite again, or if we approach them again, they'll have 20 days to prepare for a presentation, about 20.
Yeah, that should be fine. I mean, right now they're doing appropriations bills. And so,
okay.
There's a flurry of activity behind the scenes as they're going to write about $8.5 billion worth of checks. So there's a lot of work in the background. So hopefully when that's all wrapped up that we can get somebody from HHS.
Okay. Do you happen to know anyone at the Department of Education? Anyone else know?
I don't know the director.
Okay.
I mean,
Okay. Well,
I can, I'll talk offline with Kyle a little bit, or we can email and you tell me what you want. I can see what I can do.
Okay, sounds good. Thank you. Yeah, I mean, ideally, if we could have one of these speakers, one or two of these speakers present on the 23rd, that would be ideal because we have two open spots. An alternative as well would be to reach out to two speakers or two individuals who other speakers had recommended to us, and those individuals, Kyla, if you can offer them to the committee, and I'll scroll down here.
Yeah, it was Okpara Rice, who
Right here.
was the executive director of the Tanger Place, which is providing mental health care services, I believe, to a specific population, and I don't want to misspeak, but I believe it's the LGBTQ community. And then Melissa Lear was recommended by Courtney Cook in the initial outreach call. And she is one of the kind of contracted service providers throughout the state.
And I recommended Deb Carr from a consultant with the Des Moines Public Schools. Has she given an indication when she might be available?
I have emailed her twice and have not heard back. It could be my email address. I know that it does throw some people off. It is a general intern address. If you would be willing to ping her, that would be wonderful. Otherwise, I can try emailing again.
Okay, I'll send her your email address. How's that? Okay, great.
I'm also happy to just forward the email to you so that you can see what the communication has looked like, and we can go from there.
Okay, sounds good.
Right.
So in terms of action items for the committee to consider, would you like for us to approach these two individuals who were recommended by panelists as backups for the May 23rd web briefing as backup speakers in the event that the Department of Health and Department of Education are unavailable to participate? Because that web briefing, we only have two speakers lined up.
I think we should.
Yeah, I'm fine with that.
Allan, Kyle, or Paul, any comments?
Sure, I'm fine with it.
That. Yeah.
Okay. Okay, we'll go ahead and pursue them as well as following up with the Department of Health and the Department of Education. And in the event that we have a lot of speakers lined up, we could potentially offer May 30th as a date so that we can have 4 or 5 speakers present at one of those at that briefing. Okay. Any comments or questions?
Nothing here.
Okay.
We did it in record time. Look at this.
Yeah.
I credit you one.
Truly record time. One thing that I just wanted to add is, this first web briefing, if you happen to think of any other questions that you would like to ask the panelists, feel free to shoot those questions over to me and I can pass them along to them. You know, as you all are familiar, following these web briefings, I'll provide a link and as well as an attachment to the transcript. So as you're reading through the transcript and possibly listening to the recording, if anything strikes you, if you think of questions, you know, especially ones that are related to civil rights and recommendations, please feel free to email me. This information is really helpful to drafting your report, helping to inform future speakers. If you decide after the third web briefing that, you know, there are some missing perspectives, all of that will be helpful as you work toward like the end of your final work product.
Would you be sending the PowerPoint that the first speakers have, the Iowa School Counselor Association? I think that would be great for the committee to have as well.
Yeah, so this link that we actually put in the chat, it'll house all of the web briefing documents, including, you know, transcript, recording, presentation slides, written testimony, anything, any supplementary information, it'll be in that link.
Perfect.
Yeah, and we'll send an email.
Okay.
Okay.
All right, my friends. Well, thank you for everything. Thanks everybody for making the time. Hopefully we'll get the rest of the team next time. And
so before we go, I just got a text back from Kelly Garcia, and she says that they can have somebody on the 23rd.
Yay. Thank you so much.
To know Allan is to know everybody.
Perfect.
Can I put that on my website, Juan?
Yes.
Okay, thank you.
And tell Kelly
build the brand.
Says hello, even though she doesn't know who I am. But she has a beautiful last name.
Yes.
Thank you, my friend, for doing that. That was fast. Thank you.
Sure.
Wonderful.
All right.
Okay. Good to see everybody.
Thanks, everybody. Have a great rest of the Friday and a great weekend. We'll see you.
Thank you.
Thanks.
Bye.
Bye-bye.
Thank you, everybody. Bye-bye.